إني دكتور علي عباس الموسوي، استشاري جراحة الأعصاب والعمود الفقري والدماغ، تدريسي في كلية الطب حمورابي جامعة بابل. محاضرتنا لهذا اليوم لطلبة المرحلة الخامسة في كلية الطب حمورابي حول the spinal disease. Spinal disease can lead to spinal cord compression. It is regarded as a medical emergency, independent of its cause, and require swift diagnosis and treatment to prevent long-term disability due to irreversible spinal cord injury. In this brief anatomic picture, we demonstrate the spinal column. We have a cervical region, we have thoracic, lumbar, sacral, and the coccyx. And the anatomy in the another picture showing the spinal cord, which consists of the ventral and dorsal root attached to this cord with the dura mater covering the spinal cord and the roots. The causes of the spinal disease. First, we have traumatic cause, including car accident, fall from height, and sport injury. And in this picture, we see the fractured vertebral body of the cervical spine with compression of the spinal cord, illustrated by a red area in this region. We have also what's called fracture dislocation, which is obvious in this picture. We have a torn in the ligament with injury to the spinal cord, and there will be fracture and dislocation of the two adjacent spine. Another type of spinal fracture, we have what's called compression fracture or burst fracture. In this condition, there is axial compression and load, and the fracture is usually stable. As you see in the picture, there is a compression fracture in the spine, but it is a stable spine, and the treatment almost conservative treatment without surgical intervention. Another type of traumatic spine fracture is called a wedge fracture. The wedge fracture occurs in case of flexion injury. It is also stable, asymptomatic, but may be unstable if there is a loss of more than 50% of the height of the spine or occur in multiple levels. In this picture, we see the fracture line, which is a wedge in shape, with intact the spine above and below, and also we see the spinal root emerging from the intervertebral foramen. So it is a stable fracture, asymptomatic. If it is unstable, we need surgical decompression and repair. Another important type of the spinal disease is the tumors, which is called the spinal tumor. The spinal tumor, we have a lot of type according to the location of the tumor, and the tumor could be primary and could be secondary from elsewhere in the body. We have epidural and we have intradural. The epidural one, which is situated outside the dura, and the intradural is either extramedullary or intramedullary. The extramedullary one, which is occur in the spinal cord outside the central canal, while in the intramedullary type, the tumor located inside the spinal canal. And all of these, the tumor could be benign or could be malignant one. And this picture shows the different type of the spinal tumor. We have epidural and we have intradural, and how it's compressing the spinal cord. We have another type of the tumor. It's called multiple myeloma, a bony lesion involving multiple levels of the spinal column, and it's located extradural because it is in the bone, which is outside the dura. Also, another type of hemorrhage, we have what's called dorsal meningioma, which occur in the thoracic region of the spinal cord. And this type occur intradural extramedullary. And in this picture, which is an MRI of the thoracic spinal cord, we see a lesion which is located intradural extramedullary, which goes with the dorsal meningioma. Also, another type of a tumor occurring in the cervical region, we have what's called cervical ependymoma. It is an intramural, intramedullary, from ependymal lining of the ventricular system. We see in this MRI a hyperintense lesion occupying the C3, C4 cervical spinal region, and mostly it's called cervical ependymoma. The third cause of the spinal disease, we have a prolapsed intervertebral disc. And this is picture, show the brief anatomy about the spine. We have what's called the vertebral body, and we have two pedicle, two laminae, and the spinous process. And we have the disc material composed of a central part which is called nucleus bulbosus. It is a mucoid material surrounded by thick fibrous layer which is called annulus fibrosus. And the disc prolapse occurs when this nucleus has merged from the torn annulus fibrosus. So in case of the disc prolapse, we have different type. Either protruded disc, as shown in this picture, or we have extruded disc when there is a ligamentous injury, and sometimes we have a sequestrated disc when there is part of the disc sequestrated and enter the spinal canal, and the piece of the nucleus bulbosus will migrate caudally or cephalic according to the motion of the spinal column. So in the disc prolapse, we have protruded, we have extruded one, and we have sequestrated disc according to the mechanism that triggering this type of disc prolapse. The stage to a disc herniation, in this picture we have a normal disc, and the second one there is early degeneration of the disc. We have a prolapsed disc, extrusion, and sequestration. All of these can cause finally compression of the spinal cord with root pressure, and the patient will complain from the back pain and lower limb pain. Also in this picture, it's very obvious. We have a lateral herniation of the disc with the compression of the spinal root. We see how the disc migrates laterally, compressing the spinal root, and the condition presented as the patient has a radicular pain, that means a pressure on the root from the spinal cord. Also in this picture, we see how the disc material migrate and protruded laterally, compressing the root and causing severe root pain or severe radicular pain, which is distributed along the course of the nerve. In this condition, the fourth cause is the spinal stenosis and the cervical spondylitic myelopathy. This is MRI of the cervical region showing spinal stenosis at between the level of C4, C5, C6 with the compression of the spinal cord. This different picture showing the lesion which is called the spinal stenosis. We have prolapse, disc prolapse, and we have an osteophyte, and we have thick ligamentum flavum, and we have sometimes disc bulge, all the element called spinal stenosis, and causing the patient to complain from the back pain and the lower limb pain. So these element from the osteophyte, from the disc prolapse, ligamentum flavum, give the term spinal stenosis. This is an obvious picture showing multi-level lumbar stenosis. We see the osteophyte with the hypertrophied ligamentum flavum impinging the spinal cord, causing what is called lumbar stenosis. The fifth cause of the spinal disease is an inflammatory disease, especially rheumatoid arthritis. We have what's called focused costovertebral joint affect the fused vertebral articulation, and we have the fused sacroiliac joint. The sixth is infection. It's either acute or chronic, either iatrogenic or hematogenous or bentratic, and sometimes could be chronic. Another cause of the spinal disease is the spinal manipulation. This is in brief the most common causes of the spinal compression. We have in extradural, we have intradural extramedullary, and we have intramedullary 1. The symptoms of the spinal disease. First, we have local back pain, radicular pain along the root of the vein involved. We have a weakness. The patient cannot walk or can walk with the support, like in this picture, an elderly woman cannot walk because she has a lower limb weakness. Also, the patient has sensory disturbances like paresthesia or hyperesthesia or loss of sensation. Autonomic dysfunction. The early sign of this include loss of bladder control, hesitancy, urgency, and the late sign include urine retention, overflow, incontinence, constipation, loss of perspiration below the level of the lesion, and sexual difficulties. We have the spinal cord syndrome. Due to the spinal disease, we have complete, incomplete, like central cord syndrome, anterior cord syndrome, posterior cord, or Brown-Sequard syndrome. Diagnosis by history and clinical examination, hematological investigation, radiology, and other like nerve conduction and electromyography. The treatment of this condition include pharmacological treatment, analgesic, antibiotic, steroid, and the others. Non-pharmacological treatment include surgery. The patient might need in case of a trauma fixation, or radiotherapy in case of a tumor. And thank you for your listening to my lecture.